You're listening to Planet Vero Radio. I am Cindy Schwartz, and this is Patient Partners Show. We are broadcast on 101.7 FM Real Radio, WCZR, and we are also podcast on Spreaker. Jeannie Rolla, my co-host with me today. I'm being tongue-tied today, Jeannie, because I'm just so, I'm boiling over with what I'm reading here because it just personally happened to me. You know, it's never ending. You and I talk about that all the time. And I stay in the healthcare system because I do, need follow-up care for certain situations and whatever. So I was presented with this paperwork from a doctor that is associated with a clinic here in Florida. And the paperwork states billing information for patients who have appointments in doctors' offices or outpatient clinics. When you receive, and I'm quoting, when you receive services in your physician's office or outpatient clinic, your billing statement will show either a facility and or treatment room charge under the hospital services section of your statement. Your billing statement will show services in two categories as noted below. Hospital services covers the use of the room and any medical or technical services, supplies, or equipment. The facility and or treatment room charge will be shown here. Physician and clinical professionals covers your doctor's services, treatment, or procedures. And it goes on to say the facility and or treatment room charge is the result in clinics, physician offices, and outpatient clinics being classified as hospital outpatient departments, also called provider-based facilities. And then it gives a list, and it talks about Medicare, how this affects you if you have Medicare. And some of the some of the office visits are office visit level 2, an extra $14, office visit level 5, an extra $44, an echogram is $43 for that room. What else do we have? Joint injection is $8 more, chest x-ray is $7 more, skin biopsy $13 more, it goes on and on. So Jeannie Roller, I was floored when I read this. I'm like, so now I'm paying the doctor and paying a charge for actually using the doctor's office as my outpatient treatment room. And wow. What do you think, Jeannie Roll? You told me some stuff before we just went on the air, and I'm like, wow, what is this about, and what are we paying for next?
Well, Cindy, from things that I've read, it's been going on for years. It actually happened to my husband back in 2007 for cancer surgery. He was charged for the assistant physician to make the cut for the surgery. That was a separate charge. That's kind of like your facility charge. They've been finding ways to make extra money for years. It is, how can you have a surgery if there's no cut? Isn't that part of the surgery? It's like you and I were talking earlier. You said, well, if you go shopping at a store, do you have to pay a facilities charge to go and buy their product?
Mm-hmm. So do you pay customer rent walking around the store to look at the clothes that you're going to buy from the store anyway? Is that the same thing? I mean, that's my example. Because I'm flabbergasted.
Right. And it would appear from reading Medicare's site that these fees may be different state to state. I didn't have time to unzip the file, but it looked like there might be different fees state to state too. So if you live in one state, you could pay more than if you lived in another state. It's just mind-blowing that, mm-hmm. That you're doing this. I know that people electronic medical records, when you type in a message to your doctor, doctors are now starting to charge for the response because they say it's using their medical expertise. So therefore it's billable time. So a lot of people are being surprised by that. It's just, they keep finding ways to make more money. It's like being double taxed. In my opinion, it's just ways to make more money off of the same thing that you've already been charged for.
Well, it's almost like, you can't be accused of, I'm doing it the backwards way, but you can't be a double indemnity or whatever in a crime. So once that's done, you can't, but what are we actually paying for? So now if we're going to buy a loaf of bread that comes in a wrapper, are we going to pay for the wrapper separate? Okay, so the bread is, I guess some places do that. That is true. I've seen where you pay for the bag. That if you want a bag, it's a nickel. If you want, this paper bag, it's a dime, whatever it is. It's just crazy. Wow, I'm just flabbergasted. I really am. I'm like, when does this end? And it doesn't. It doesn't. So when I was talking with the doctor, she was telling me, it was a primary care doctor, she was telling me, everyone is having a problem with this worldwide. Worldwide, people, they just really don't know what to do to get a rein on this stuff. And then her nurse, who is an LPN, was telling me that, it's corporate medicine. It's corporate medicine. These doctors have thousands of patients that are working for these corporate medical places, because I was talking about concierge doctors, and especially a lot of ones I know recently, we talked about it, that have gone, primary care doctors have gone to concierge medicine. And the nurse said, well, yeah, then that doctor gives you his or her cell phone number and they're on call 24/7. And I'm like, right, but they have 150 or 200 patients. Isn't that kind of what healthcare used to be, or doctor care used to be, not that distant past? So, but what's the difference of it now? So this doctor working for a corporate entity has thousands of patients. The doctor that's giving you a cell phone number, or her cell phone number, has got 200 patients 24/7. Okay, is it the quality of care for the patients? Isn't that what we're all talking about needs to be rectified? Well,
you also told me something pretty interesting, Cindy, was about the lab work.
Oh, so the lab work, yeah. So talking about that, this was somebody else telling me this, and it was just like 2 days ago, saying that I am, as the patient, so I happen to have Blue Cross and Blue Shield insurance, okay? That's pretty, I don't want to say popular, but well known. I mean, just about everybody in the United States, I think, has heard of Blue Cross and Blue Shield insurance, so it's not obscure. That person was telling me that I am now, as the patient, responsible for telling all of the directions that Blue Cross and Blue Shield needs to go to be have my bills paid. So is it going to go to Quest? Is it going to go to LabCorp? Is it going to go to all these different places? I'm responsible for telling them what they are. So I said, well, what about the departments in the offices and hospitals and whatever? Don't they look this stuff up? And they're like, no, they don't. They're not responsible. You, as the patient, are responsible. I'm like, okay, so now, like we were talking, now that I'm out under anesthesia and I'm responsible still at that, and I'm kind of making fun of it because it is kind of funny, to wake up during my surgery and say, okay, make sure you send that pathology to so-and-so. Don't be sending it to this when they're out of my network. I mean, it's kind of facetious, but that's crazy.
And, many times people have gotten bills because they've had an out-of-network provider that they had no clue, because, you give them your insurance card when you go in the hospital. You expect that they read it, they take that information, and they'll do their job from there. Mm-hmm. They'll protect you. But that's not so. That's not true. Many people have out-of-network providers do stuff for them, and then they are charged big bucks for that. And that is not right, because what is the purpose of giving them your insurance card and saying, do you accept so-and-so insurance, if they're not going to abide by that?
Well, right. I mean, and it's, again, it goes back to the trust aspect. So now that's all put back on the patient. So how many questions do we know to ask, not being in that profession? You kind of play catch up or whatever. But so I'm just mind boggled, Jeannie. I don't even know how to grasp this. I really just don't. I just don't. I don't know why I have the insurance I have. I thought there were people in the departments to do these kind of things. I thought that there were people they were, paying to looking this stuff up. I don't know. I just don't.
Well, I'm surprised, Cindy, that it hasn't caught on before now on the facilities charge, because like when you go and have tires changed on your car, you get charged a disposal fee.
Right.
When you buy paint for your car at the auto parts store, you get charged a fee for disposal. There's always a way that professions or entities are looking for a way to make more money off of the same thing.
Mm-hmm. Yeah.
It's just mind-boggling.
It is mind-boggling. Yeah. So I've got it. Yeah. Mm-hmm. So we're out of time, Jeannie. You've been listening to Planet Vero Radio. Please stay tuned.